Emily Harris attended the University of Arizona, where she graduated in December with a master's degree in public health. Even before then, she had a job in Cochise County.
I'm the infectious disease program manager for Chiricahua Community Health Centers.
And how long have you been there?
I just started actually early October, so it's been about 4 months, relatively new.
And what a time to begin her career. A worldwide pandemic affecting billions of people without enough vaccines to fight the infections, at least currently. It's been an intense introduction to her chosen profession.
It's definitely a lot of curveballs thrown at you day by day. Information is always changing, challenges are always coming up, and everyone's just kind of rolling with the punches as best as they can. They have a pretty great team supporting me, so I'd say it's been going pretty well so far.
At Chiricahua Community Health Centers, where she works, staff have been able to vaccinate close to 80% of their workforce and hundreds of patients. The company has 11 clinics, 4 pharmacies, and 5 mobile units in Bisbee, Douglas, Wilcox, and other communities. They were forced to stop vaccination events for the public due to a lack of allotted doses and financial support.
We are able to administer about 600 to 610 per week. We've struggled with funding to be able to hold large vaccination events, like ones that we've done on the weekend where we can vaccinate over 300 people in a day. So we are struggling to meet the demand.
And her predicament is part of a common scenario across the state. Jeff Terrell works in Nogales, west of Cochise County, which is desperate for more vaccines.
We have reached out to the state. I have put challenges out to the state. I've challenged them to give me more vaccines. I will get them in their arms. We've asked for more. We've had our Board of Supervisors advocating. We've had businesses down here advocating for more vaccines. And unfortunately, there's just not enough available. So we continue to advocate for more, as every county is. So as soon as we get them, we're putting them in their arms.
Santa Cruz County has around 47,000 residents, and about 2,000 have received both required doses of the vaccine. Local officials would love to do more.
I don't know if we could get 10,000 a day, but if we got 10,000 a week, we could get them in their arms. We have the capability of ramping up several other pods, and we do have people on standby as far as people that can vaccinate. So we are ready to ramp up and open up more pods throughout the county to get the people vaccinated.
While the majority of Arizona's more than 7 million residents live in the Phoenix or Tucson metropolitan areas, Arizona also has hundreds of thousands of residents in its other more rural counties. These are often expansive and can encompass more territory than some states. Arizona also has nearly 24 federally recognized Native American tribes, so experts say it can be challenging to coordinate between governments, agencies, and medical groups to get everyone vaccinated. In addition, the current vaccines, Pfizer and Moderna, have to be kept well below freezing temperatures while being transported and stored. Dr. Dan Dirksen is the director at the Arizona Center for Rural Health at the University of Arizona.
Help's around the corner, and we're expecting before the end of the month the emergency use authorization for the single dose Johnson & Johnson vaccine, which has far less stringent cold chain and refrigeration requirements. So that will be of a huge amount of assistance for these rural and frontier areas.
Because of its size and demographics, Dirksen says Arizona faces some pronounced difficulties compared to more urban regions. These include long distances between patients and their healthcare providers, elderly or poor residents without reliable transportation, limited access to computers or the internet, and barriers with the English language or a lack of childcare. As more people get vaccinated, there should be a decrease in residents who get sick, which will relieve some pressure on the medical field. But experts stress that it's too early to let our guard down. They recommend continuing to follow CDC guidelines to reduce the chances of infection.
There is still quite a residual of an anti-vaccine movement. We haven't seen that yet because the demand has far exceeded the supply. But that will come around because that still creates a pool of vulnerable individuals who either haven't had the infection or haven't had the vaccination that can still get COVID-19.
Are you looking forward to, let's say, 3 months, 6 months down the road when things will have settled down somewhat?
I think so, yeah. Just being able to open up to a broader range of infectious disease. We're currently also working on a project that tackles issues of infectious disease on both sides of the border because we are so close to Mexico and the state of Sonora. So looking forward to that. But I'm happy to be doing my part in COVID response and tackling the pandemic at hand right now as well.